All right, welcome to The Explainer. Today, we're diving into something pretty wild, a disease where your own body turns on itself, where the very system designed to protect you becomes the aggressor. We're talking about rheumatoid arthritis.
So let's just think about this for a second. What if your body's own defenders, your immune system, completely lost the plot? Instead of going after things like the flu or a bacterial infection, it just declares war on you, on your own body. That right there is the essence of an autoimmune disease, and it's exactly what we need to get our heads around today.
And that's where rheumatoid arthritis, or RA for short, comes into the picture. It's a chronic, a long-term disease where that mistaken identity, that friendly fire, is aimed squarely at your joints. This creates this just devastating chain reaction of inflammation and damage. So the big question is, how does this all get started?
Okay, so section 1, the attack begins. What does it actually feel like when this is starting to happen? To really understand RA, we've got to look at those first little clues, those warning signs. And we'll also dig into what exactly puts someone at risk.
So the first signs of RA are actually pretty specific. We're not talking about just any old ache or pain. A huge giveaway is that it's symmetrical. So if your right wrist is bugging you, your left one probably is too. And that morning stiffness? Oh man, it's on another level. It's not just feeling a bit creaky for a few minutes. We're talking about serious, can't-move stiffness that can hang around for more than an hour. But here's the weird part, the thing that really sets it apart. This pain actually tends to get better the more you move. Totally the opposite of what you'd expect, right?
So you've got to wonder, why me? Why does this happen to some people and not others? Well, it basically boils down to a 50-50 split. About half of the risk is in your DNA. It's just baked in from the start. There's this one specific gene variation. You can think of it like a little red flag in your genetic code that makes your immune system way more likely to get confused. And the other half? That comes from your environment, from the world around you. And speaking of those environmental factors, there is one that just blows all the others out of the water: cigarette smoking. Seriously, it is the single biggest environmental trigger we know of, period. If you have that genetic red flag we just talked about and you smoke, well, you could be increasing your risk by up to 3.5 times. It's a really scary, perfect storm of how your genes and your lifestyle can team up against you.
All right, so once these symptoms start popping up, the clock is officially ticking. It becomes a race against time to figure out what's going on and get a real diagnosis. Because with RA, getting on top of it early and hitting it hard, well, that changes everything.
So how do doctors actually nail this down? Well, they use this clever point system. It's literally like a diagnostic scorecard. They're looking at a few key things. How many joints are affected, and are they big or small ones? What do the blood tests show? That's the serology part. Are there signs of general inflammation floating around? And finally, how long has this been going on? They add up the points from each category, and if you hit a score of 6 or more, that's a diagnosis of definite RA. It's all designed to catch it as early as possible.
Okay, let's zoom in on those blood tests for a sec. For years, the go-to was a test for something called rheumatoid factor, or RF. But here's the catch. About 3/4 of RA patients have it, sure, but so do people with other conditions. It's not super specific. The real breakthrough, the total game changer, was the discovery of the anti-CCP antibody test, ACIPIA for short. This one has a mind-blowing 95% specificity. What does that mean? It means if this test comes back positive, it's almost certain that what you're dealing with is rheumatoid arthritis. It's incredibly accurate.
Okay, so we've named the enemy. Now let's go deep behind enemy lines. Let's get a look at what this battle actually looks like on the inside, down at the microscopic level of a joint.
So what's happening inside that joint is just this terrible cascade of destruction. It starts when these rogue immune cells storm the joint lining, the synovium. Then that inflamed tissue starts to swell up and thicken, and it forms this aggressive, nasty tissue called a pannus. You can think of the pannus as the main villain of the story. It's like this invasive blob that creeps over and just dissolves the protective cartilage. And for the final act, it sends out these special cells that literally start eating away at the bone itself. It's brutal, and the damage is permanent.
So who's the general calling the shots in this whole mess? What's the signal that's orchestrating this entire attack? Well, a huge part of it comes down to one molecule, TNF-alpha. It's a cytokine, which is just a fancy word for a chemical messenger used by the immune system. And in RA, TNF-alpha is like the 5-star general, screaming, "Attack!" and driving this whole inflammatory firestorm.
Okay, so knowing your enemy is half the battle, right? We know who the general is. Now let's talk about how we fight back. Let's look at the incredible arsenal that modern medicine has developed to take control of this disease.
You know, the whole philosophy around treating RA has done a complete 180. It used to be about just trying to manage the pain and live with it. Not anymore.
The new strategy is called treat to target, and it is aggressive. The goal is simple, and it is powerful. Push the disease into full remission. Or, if you can't get that, get it to a super low level of activity. It's all about being proactive and stopping the damage in its tracks.
And the way they do this is with a class of drugs called DMARDs. That's a mouthful. It stands for disease-modifying anti-rheumatic drugs. Think of these as the different branches of the military fighting RA. First, you have your workhorse, the anchor drug for most people, which is methotrexate. That's a conventional DMARD. Then you have the biologics, the BDMARDs. These are like the snipers, the precision weapons. A lot of them are designed to go in and take out that one specific target, that TNF-alpha general we talked about. And now we have the newest guys on the block, the targeted synthetics, which are really clever. They get inside the immune cells themselves to shut down the attack signals.
So treatment is all about controlling the day-to-day battle. But we have to remember that RA is a lifelong war. And it's a systemic disease, which means the fight isn't just happening in your joints. The inflammation can cause problems all over your body.
I mean, that same chronic, simmering inflammation can cause all sorts of collateral damage. You can get these firm lumps under your skin called rheumatoid nodules. It can cause really serious inflammation in your lungs and even your heart. It can lead to eye problems, and it can even attack the blood vessels themselves. This is exactly why getting the whole disease under control is just absolutely crucial.
And this all leads to a pretty sobering fact, one that surprises a lot of people. The #1 killer for people with RA isn't the joint damage itself, it's heart disease. That constant body-wide inflammation is just brutal on your arteries. It speeds up the hardening of the arteries, atherosclerosis, and that dramatically jacks up the risk for heart attacks and strokes.
And yeah, the impact on lifespan has been very real. If you look at the historical data, RA could shorten a person's life by about 7 years for men and 3 years for women. But, and this is a really, really important but, those numbers are from a different time. They're from before we had all these incredible new drugs and the whole treat-to-target strategy. The good news is, today, .outlook is getting better and better.
So that leaves us with a pretty hopeful question for the future, doesn't it? We know about the genes, we know about the molecular triggers like TNF-alpha, and we've built this amazing arsenal of drugs that can go in and shut them down with surgical precision. So as these treatments get even better, you have to wonder, are we getting close to a time when putting RA into total remission isn't just the best case scenario, but the normal expected outcome for everyone?